Hi, I'm Tom Purvis, registered physical therapist and co-founder of the Resistance Training Specialist Program. And for a long time, I've been a proponent of the Bowflex, and not just because someone came along and said, hey, I'll give you some money if you say good things about this. In fact, we've always been the opposite of that. We've always avoided those kinds of situations because we have an integrity issue and a reputation we have to maintain in order to present something like a Resistance Training Specialist certification course. But that's exactly why we can say good things about the Bowflex, because when we're talking about the things that are good about it, they're objective. It's all based on physics and proper biomechanics. And that's what Bowflex really offers you, your clients, your patients, if you're a physical therapist, chiropractor, or a personal trainer. So here's the thing. You've got people of all different skeletal structures, all different range of motion capabilities. Some people have limited joint movement. Some people have great range of motion. And you're going to have this broad spectrum of people and obviously very different strength abilities. Bowflex, mechanically speaking, can offer something for each and every one of those people, especially if you, as the professional, understand how to create true mechanical variation within an exercise. You see, the only limitations in Bowflex are pretty much what you understand, your biomechanical ability to generate variation. So that's what we're going to do here today, is go through not only exercises in the manual, because I always wanted to create a video that if someone had the manual, it offered a little more explanation, even a little more in-depth biomechanics maybe than just the start here, end here that often is associated with printed explanations or instructions. But I also wanted to talk about many more exercises that may be a little bit above the mechanical understanding of the consumer, but you as the professional will really, really appreciate. And we can also talk about now, because it's just us professionals, the shear, the compression, all the things that are of interest to us. And this really helps us to make good, smart, professional decisions about what we want to do with our patients and our clients. So sit back and take a look. Now, with any exercise, one of the first things you got to do when you're applying resistance is figure out the plane of motion and apply the resistance accordingly. In other words, the resistance has to be within the plane of motion also. And also we're going to look at how the resistance falls relative to each joint. Now, the first muscle group or joint movements that we're going to talk about are relative to the shoulder joint, and we're going to talk about the anterior shoulder musculature. Many times you've seen this referred to as a chest exercise, and of course it does involve the pectoralis major along with the anterior deltoid. So it's everything anterior to this axis of the shoulder. Now take a look. This is your flat bench chest press. The reason that we're angled, you might think it's an incline. It's not. This would be an incline if we had gravity pulling on us. Because the resistance is in line with this cable, as you can see going back to the pulley, this is the perfect chest press within the transverse or horizontal plane. From this point of view, you can see how the resistance or the load line falls through the respective joints. At the start position, you can see that the cable on each side is directed towards the pulley, which is relatively narrow, and I actually have to move my hands out pretty wide in order to get it further away from the shoulders, more like a traditional press. If I come in here with my hands, the resistance is about halfway between my elbow and my shoulder, which means I'm using an equal contribution of elbow and shoulder muscles, not necessarily a traditional press. As we get up here, we can see that the resistance falls through the wrist, the elbow, and the shoulder, becoming virtually balanced. This is due, again, to the narrow pulley position. This is very much like a dumbbell. When you come up to the top of the press, when you're using gravity, a dumbbell, again, the resistance falls through each joint when your arms are straight above the shoulders. So this is a viable pressing motion. We have a decrease in resistance back here. We are a little bit weaker in a press, a slight increase in resistance as we go up here due to the bending of the power rod. But due to the fact that we're balanced up here, you are very, 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 very strong. Now, this is not necessarily a constant tension on the muscles the way you might like it to be. For this reason, there are other options on the Bowflex. Now, on most Bowflex units that have been created over the past 10 years, there was a relatively narrow pulley position, as we mentioned before, maybe even narrower than this. Now, there is an option, not a standard piece, but one of the best options you can purchase for your Bowflex. In fact, I recommend that every single person at home have one, and if you're a health or fitness professional, it's an absolute must. Not only in dealing with different exercises, but in dealing with different sizes of people. With this unit, I can widen the pulley about 8 or 9 inches. This dramatically alters the force angle towards the hand. It's going to totally change as you're going to see how this creates the exercises for the chest, as well as shoulder presses, and even allowing for carrying angles for bicep exercises and elbow flexors. And wait till you see what it can do for posterior deltoid movements. Now again, from this point of view, I left one of them narrow, moved one of them out wide. I want you to see the difference in the force application in this specific movement. Take a look. Again, you can see the virtually balanced position of the resistance through this arm, and how when we finish the motion with this arm, the press, you can see the force angle is maintained. In other words, there's a separation between the resistance cable and my shoulder joint, which means there's a moment arm of resistance at the shoulder joint, therefore there's going to be increased muscular activity at the shoulder joint. Now, there's nothing wrong with this application. This is just, in many cases, much more effective. I'm going to move my arms up here just a little bit. This is not the plane of motion for the movement, but I think you can see better the application or the force angle. All right, let's go through this pressing movement, because different goals will require different instructions and different mechanical variations for your client or your patient. Now, take a look. Normal, functional shoulder complex movement during this press requires a slight scapulohumeral rhythm. Now, what that's going to mean to you is that as my humerus moves forward, my shoulder blades will also protract a little bit and move forward slightly. The purpose for it is so that the glenoid fossa moves forward and creates a stable, almost compressive foundation for the humeral head in this pressing position. Again, that's normal, functional pressing, things you want to be stronger, you want normal motor patterns, that's what's going to happen is scapular motion. If you have a non-functional goal, non-functional doesn't mean it's bad, it just means it's not a normally occurring goal in your innate motor patterns, such as hypertrophy. You want a bigger pectoralis major or anterior shoulder musculature region, then you may actually want to maintain some degree of retraction, not excessive, but just about neutral, but maintain it through the motion. Now you see the difference here. Here is with retraction maintained, and I get an improved mechanical advantage or moment arm of my pectoralis major, if that is in fact your goal. And once again, if it is not, do not prescribe that specific stabilization. It should look like this if you're looking for a normal press. You can see a very slight protraction, not an excessive protraction. That's not what we're looking for in this specific pressing motion. There's two options for you. Now again, from this view, you're looking primarily at how the resistance falls within the plane. Again, there's that horizontal or transverse view, but we do have variation that can be created relative to plane of motion, our incline or decline type of presses. Now with a dumbbell, of course, you would change the angle of the bench in order to create that change or that variation. It's going to be a little bit different on the Bowflex, but pay close attention. You see, if we were in this typical flat bench type press right here, and I hope you can see again why that's flat bench. If I just move to this position thinking, hey, I'm above that now, I'm angled above it, I'm doing an incline, I hope you can see the problem relative to the force angle of resistance. Here it's actually creating a rotating force because it's not lined up through the joints. Up here it's creating a flexion force because it's not lined up through the joints. So in order to create an incline on this machine, just a simple little maneuver, keep your feet on the lower leg of the unit and just come up to the top where your head is near the power rods. At that point, you can press maybe 20 or so degrees above the horizontal plane and get your effective incline. It works very well. Now take a look. For the decline, we'll go back to the previous position where you're on the seat of the bench, and we're going to flip the handles over. You saw that little maneuver. So the resistance is below my elbow. Instead of the horizontal plane, will be 10, maybe 20 degrees below it. That is plenty for a decline. Make sure before you make the mistake of trying to do a very steep decline far away from the horizontal plane, that you review shoulder structure and shoulder mechanics. Because when you're abducted from your side, and you try to internally rotate more than 10 or 20 degrees in most people, you create impingement. Be aware. All right, now of course for every one of these pressing movements, we can take the resistance, transfer it to the other side of the elbow, and instantaneously we have a fly. In fact, that's the main mechanical difference in force application between a press and a fly. It simply falls outside the elbow. How far outside the elbow you put it is up to you. For every one of these flat bench, inclines, and declines, we can create a fly. There are things I'd like for you to consider, however. Maintaining a press type position for your hands works very well in a fly. problem is when you achieve a typical fly position, again, I do not recommend this. It's okay if you do it, but make sure that you don't achieve it by externally rotating the shoulder. If you're going to achieve a fly position, and again, there's no point in it except habit, you really want to do it with only the supination so that you maintain the proper shoulder mechanics. Externally rotating the shoulder takes you to the close pack position. There we can potentially have a problem. So let's stay away from that. Now, the other thing that you must keep in mind, you must mechanically be aware of the fact that a fly, weight further from the shoulder, has increased shearing force to the shoulder when compared to a press. For that reason, you must have a substantial benefit towards a very specific goal in order to use a fly. That goal, of course, cannot include such mythological benefits as affecting one part of the pec as opposed to another. Those are not benefits of a fly as opposed to a press. Forget what the bodybuilding magazines say. Think about the shearing forces involved, and for most people, patients or clients, the press is a better choice. Using the squat attachment as a bench press is a pretty good idea. Look at some of the advantages. The resistance profile is one huge advantage. Number one, when I'm up here at the top, I'm really strong as my limbs are in a balanced situation and the resistance is near a maximal flex in the rod. As I come down here, the resistance is decreasing, or I'm mechanically weaker. What a great idea. Now, one of the slight limitations is the fact that this chain or cable has to wrap around one side of my arm or the other. Now, it's not too bad. You want to make sure that the cable is not removed from your arm very far and creating a force angle towards flexion. You also notice that you have a range of motion adjustment. I can choose the link that I place the hook in to attach my resistance. Therefore, I could start the resistance at this range of motion, have it going up, or I can have it progressively lower. You see, I have resistance even at this starting position where these pads are touching my chest. But if I didn't want to go that low, I certainly wouldn't have to. Now, as we continue looking at this anterior shoulder musculature continuum, moving from the muscle fibers down here all the way up, of course, we start to emphasize more of the upper pec, anterior shoulder, even middle delt, anterior middle delt, by looking at a shoulder press. And you'll notice the narrow pulley position in this specific movement. And I get to the top again, it's virtually lined up through the joints, very similar to a dumbbell press. So the top, I'm very strong mechanically, but the resistance doesn't match it very well. Okay, even though it's slightly increasing, my strength is amazing. Now look, if we take advantage of the wide pulley option, what do you notice? At the top, I'm not able to resist, or rather rest, quite as well. The resistance is falling further from my shoulder joint. It's out here. It's not balanced through the shoulder joint. So right there, you have a second variation. Both of those, the narrow pulley option and the wide pulley option, are ideal for creating variation in these specific exercises for your folks. But there's something I really want you to look at, something as far as setting up the Bowflex, and you have to look from a side view. Now take a look. From this point of view, you can see something very important relative to the plane of motion and the application of resistance. If I push straight up in the frontal plane, the resistance does not fall within the plane of motion. You can see that. So what I'd have to do, due to the fact the pulley is slightly behind me, I'm sitting in front of it, I have to move at an angle congruent to the application of the cable. So it's very slightly angled, maybe 10 to 20 degrees anterior to the frontal plane. Works out perfectly, no problem. You do have another option though as well. If I lift these little supportive bars underneath the bench up and over part of the frame so I can move this back further, now the bench is against this vertical main frame right here. Now I can scoot my body all the way back because I have a little seat back here, and I can virtually rest against the power rods, the remaining power rods that I'm not using, unless of course you're so strong to use them all. But you see how my application of resistance is more congruent with the plane of motion in the frontal plane? And if you can see that, you can see how there are many, many options on the Bowflex. I still, of course, could move anterior to that if I chose to. I can simply put the resistance cable on the other side, and I have my little bit of forward application if I want to. So again, if you understand resistance application and plane of motion, you've got it made on the Bowflex. Continuing on with the anterior shoulder musculature, but looking more up here towards the anterior deltoid. Again, all of this is going to be involved, just emphasis in certain places. Let's look at a front raise, which is really just straight arm motion, sagittal plane. What I really might want to do while seated in this position is move forward a little bit. Because I'm sitting way back here, I have a lot of slack. I don't get resistance from the starting position. So if you have strength from the beginning here with your client, your patient, right there, just sagittal plane motion, you really should watch. I've got the pulley moved to the inward position. I don't want to start moving outward from here because my shoulder is not positioned directly over the pulley, therefore I can't start moving directly outward from this. So pretty much a front sagittal plane type motion is all you've got from right here. You can, however, turn it into a pressing type motion. Some people call it a resisted punch. I would simply look at it as a sagittal plane press, but notice I have the cable on the medial side of my arm pressing straight forward like this. And of course you could incorporate ideal or perfect trunk rotation with this if you chose to, along with, of course, scapular protraction, which is part of pressing or punching. And it's real important to realize if you're going to add the trunk rotation with it, that you must be in vertical, erect, proper posture. If you are seated in a crummy flexed position while trying to rotate, you're violating that type 3 coupled motion of the spine that you need to study in the biomechanics text available to you. So ideal posture, and then with the press, and even with the rotation, if you choose and if you do it correctly. Now another version for the sagittal plane movement, this front raise, so to speak, is in the supine position. Of course, a lot of people find that comfortable. You have to get pretty close to the unit here, the vertical part, by bending the knees and the hips. A couple other options you have. Externally rotating as you move in the sagittal plane, front raise, no problem. Will involve a little less medial deltoid, a little more anterior. As you go to the internally rotated position, you're going to involve a little more medial, and you can feel the difference as you do the motion in the shoulder. This is not just a matter of supination and pronation. It's a total change in shoulder position, which again changes the relationship between these muscles and their axis of motion relative to the resistance. Now as we continue on around the shoulder, moving from the anterior shoulder muscles to what we might call the superior shoulder muscles or the lateral shoulder muscles, depending upon how you look at it. Either way, they're above or outside this axis of motion that would be considered frontal plane motion. The more traditional lateral raise with the handles in the hands and maintaining maybe a slight bend in the elbow, not quite locked out or straight at the elbow. That's really a matter of comfort. And going straight out to the side. Now notice, my position relative to the pulleys creates an angled application of force. Can you see that? Angled towards me, not straight up and down with me. Well, that is actually pretty nice. You've seen people before with the dumbbells in their hands bending a little bit forward in order to create an application of force through the middle deltoid, which is positioned slightly posterior, very slightly. Well, a very slight application of resistance to the front, now I don't have to bend forward. I only had to bend forward when I had gravity pulling straight down. I had to change my body position relative to gravity. Well, now the resistance has changed relative to my body. I can remain erect, which is easier for so many people that you're probably working with relative to spinal stabilization. And there I have that same application of force. This works really, really well. And again, with all these exercises, I can do them independently, one arm alternating with the other simultaneously, and I don't have the effects of inertia, which is one great thing about lateral raises as well as the other exercises. With this weight that they're moving, they can't just swing it around. It's more of a constant tension, if you will, because we don't have the physics effects of a gravity-based resistance. Now I want to show you a couple of really neat things we can do with lateral raise type motions, especially on the Bowflex. Now from this seated position, take note of my relationship to the resistance this time. That pulley is higher relative to me, or obviously I'm lower relative to the pulley. But the point is it's a little more of an anterior resistance, not as much of a downward resistance from this point. So I have some decisions to make, and actually I'm heading towards the continuum of medial deltoid to posterior deltoid, and I have decisions to make relative to that. I could again do this with just that weight in the hand, handle in the hand, and pulling from the respective side, left handle, left hand, and so forth. I could also cross these over, and immediately changes the application of force relative to the plane of motion. It's still within the plane, I'm still moving relative to the plane, but the resistance is more across. So in a sense, my starting position, which right here had no resistance before, now has resistance. The starting position has resistance as I move outward. That's a really neat application or great variation. Now, you can see also that my body position will change things as well. I can lean back a little bit if I'm good at stabilizing, using the abdominals and keeping an erect posture. And I can direct it more towards that medial deltoid we were talking about earlier. You can see how the resistance is coming from an angle similar to when I was standing. If I sit more erect on this, it's going to involve a little more posterior deltoid by taking the resistance and not being so downward relative to me and being a little more towards the horizontal plane. But there's still another factor that determines medial deltoid versus posterior deltoid and contribution. They're both always working, but my position of rotation will determine which one's opposing the resistance. If I am, for example, internally rotated or in neutral here, this is going to be a lot of posterior deltoid. If I do this from an externally rotated position of the shoulder, it's going to be a lot more medial deltoid. So you have those choices to make, and they're all great variations. But one more time for all of those. You remember the fly versus the press, and one of the differences in the shoulder joint? It was the amount of shear. Some joints are built to deal with shear. Shear is not always a bad thing. The shoulder joint is not great at dealing with it. So anytime we can reduce it, it's a good idea. Watch this. I move these handles. They separate. You can put them around your ankle or you can put them around your forearm. And now the force is applied closer to the shoulder joint, which automatically reduces the shear. And right here I can perform all of these exercises. Now you can really tell I'm externally rotated. So as I perform this motion, there's a lot of medial deltoid involved here. This is a great exercise. Again, the crossing resistance and the application to reduce shear. Now the shoulder press with individual handles really gives you a lot more options. Number one, I can do alternating presses if I choose. I could do simultaneously alternating, which is really one of my favorites. And I can also change the plane of the press. Here I'm more frontal, and I can bring it closer to the sagittal, kind of 45 degrees anterior to the frontal plane. I can even come almost pure sagittal, just like this. So there's a lot of great options when you've got the individual handles. Also with the individual handles and the chains removed, I can do a form of a lateral raise, even if I bend forward a little bit, keeping my spine in proper alignment. I can move 45 degrees anterior to the frontal plane. I can move in the sagittal plane. A lot of great options here with these individual handles. And of course, separate, forearm, and right there I have reduced shear. This is a great exercise. Now I mentioned posterior deltoids, but let's look at it again. As we have an application of resistance that's a little bit lower than my shoulders, if I really want that resistance to be in the transverse plane, I'm going to have to lean a little bit. So you'll notice me leaning forward, but not slumping forward, not slouching. I'm keeping my alignment. And now it's closer to that transverse plane, and I'm not rotated, so the posterior deltoid is doing the vast majority of work here. Scapular muscles, what's happening? I have a choice. Again, anytime you have considerable range of motion in the arm/shoulder, you're going to have scapulohumeral rhythm. So you could let your shoulder blades move forwards and backwards, but also you'll notice in the glenohumeral joint there's plenty of range available in that joint alone that if you chose to stabilize the shoulder blades with a static scapular muscle action, you could have just shoulder motion and just the posterior shoulder muscles like the rear deltoids. Another great option for the posterior deltoids is crossing the resistance, keeping it within the plane there. And now as I go to this position at the start, I've got some resistance to deal with. It's not just straight forward in front of me, balanced. This is a great application for the posterior deltoids. I want you to see it from another angle. Now take a look from this direction. And you can see that with the left handle in my left hand, the right handle in my right hand, I have resistance and then kind of no resistance. Even if I scoot back to where there's still tension via the power rods, the resistance is lined up through my arm. For that reason, I can cross them over. I've got the narrow pulley position, but take a look at this. You can see the application of force now right there. I'm bending forward a little bit so it's perpendicular to my torso. And I have resistance from the start right here, from the very beginning. I have resistance from across. Very, very nice. Use this application for resistance every time you get a chance in the horizontal plane. Now I want you to just take a look at the very end of shoulder extension. Some people call it hyperextension. I just call it extension behind the body, because most people refer to hyper as being too much or not normal. This is normal extension, normal available shoulder extension. But take a look. The angle of the resistance with the pulley being below me, below my hand, creates it so that as the lat's starting to fail or lose its mechanics relative to the shoulder extension, the rear delta is all alone, and I'm getting maximal resistance, 90-degree force angle relative to my resistance at the point where the rear delta is doing most all the work by itself. I'm about 30 or so, 25 to 30 degrees of shoulder extension. So that's a nice option for people that want to work that part of the posterior shoulder musculature but have trouble abducting far enough to get to the horizontal plane. And I can create a slight resistance variation on that by being seated. When obviously when I'm seated, the pulley is more near the height of my hand. That means I'm getting maximum resistance relative to force angle when I'm just right here at about neutral extension. The resistance is going to slightly decrease relative to the force angle as I move backwards, but as the rod flexes, the resistance increases very slightly. So this may be a consistent application of resistance through here. If I need more range, I can scoot forward a little bit, and there it is. But just watch that you don't end up using a bunch of trunk motion or even scapular tipping when really you're trying to affect posterior shoulder. Let's take a look at some rotator cuff involvement. Now, this application of resistance right here would be primarily for the external rotators, the teres minor, the infraspinatus, and of course you're going to have involvement of the posterior shoulder musculature such as the posterior deltoid. Now, take a look. Resistance this way, my plane of motion, here's the axis. Now remember, this is a really common external rotator exercise, but it's also very non-functional, meaning this is not a huge motion involved in life. Although it's a small part, that musculature performing that specific motion can be a small yet integral part of many other motions. But this is a great way, even though it's non-functional, quote unquote, it's still a good exercise for improving the tissue integrity. And if you've got someone who's been standing in poor posture and standing with internal rotation right here in the upper extremity, this may help to improve their posture along with the other scapular musculature training as well. So the thing is, we can create variation. We don't want to just train it in this position. In fact, we have limited range of motion in this position of neutral. When we abduct from the side, we get a better range, but we also have to change our application of resistance because the plane is now different. So if I kneel or stand near the bench, I have an angled resistance, as you can see very well. So when I'm abducted and my plane has changed, I have resistance again within the plane. I have to work a little bit harder to hold this from the side, but there's nothing wrong with that, helping to stabilize here. Now I can change it further by abducting even more, maybe 80 or 70 degrees from the side out here, and having a resistance from the front and down a little bit. Look at that variation. So all these are really nice. In fact, I encourage people, if they're going to do just a pure rotation, to use different positions in an attempt to make better use of or greater variety of motor patterns. Now, have you ever had those people who have tendinitis, maybe an epicondylitis in the lateral side of the elbow, and gripping things was hard, especially when the grip was pulling them into, the resistance was pulling into flexion, they're having to use their extensors? I can get away from that in exercises like that rotator cuff by spreading the handle from the strap, and I don't have to grip it anymore. And for a lot of those rehab patients you have out there, this is a great, great option. So take a look at that. Now, there's a couple other things too. I can obviously do internal rotation just by changing my position on the bench. I can go through this non-functional variation right here again. But as you start to have the desire to integrate this musculature with a more functional motor pattern, trying to get the bigger muscles to integrate in with these smaller rotator cuff muscles, watch this. There's such a thing as a PNF pattern. I know you've heard of PNF patterns, but you may have heard the word PNF or the abbreviation PNF in reference to PNF stretching, and that's really a misuse of the term proprioceptive neuromuscular facilitation. It has very little to do with stretching at all, and it has to do with a neurological motor pattern where certain muscles work really well together. And here's an example. Usually they're motions of diagonals that involve not just a pure diagonal, but rotatory components as well in the extremity movement, going clear down even into finger movements associated with shoulder movements. So a great example here is starting an internal rotation. And as I abduct upward in a diagonal, I'm going to externally rotate. Now, I'm going to have to scoot a little closer to the pulley here so I can get all this in, but I want you to notice how I'm grabbing the handle. I'm not splitting it like this off of each side of my hand. I'm grabbing it so it comes off the top, and that way it provides resistance against my external rotation. Can you see that? And I can scoot even closer to try to get more motion. There you go. And that may be part of progression, more motion as part of progression. But you can see that I'm abducting upward and outward as I'm externally rotating through the whole arm at the same time. So there's a lot of neat variations for the rotator cuff, and many more if you're creative. One of the rotator cuff muscles that really should be addressed, in fact they're all working in this situation, is the pure abduction. But when we use a downward direction of resistance such as gravity, dumbbell, something like that, we don't get much resistance until we get out here a ways, and actually the medial deltoid starts kicking in quite a bit when we get out here. What we'd really like is resistance from the beginning point right here. So with the squat attachment, I can take the handle, pass it underneath, and I'm not going to need a huge range of motion. But you can see my direction of resistance from over here. And as I abduct from the very beginning, I have load now. This is wonderful application of resistance. And I can go up to about 60 degrees of abduction. This is ideal for the beginning stages of supraspinatus work, as well as the steering mechanism offered by the other three aspects of the rotator cuff, teres minor, infraspinatus, and subscapularis. What about the scapular musculature? Well, really, in true function, in normal function, the scapular musculature works to create a type of unison or scapulohumeral rhythm with arm motion. And in our overhead presses we performed earlier, that was a great scapular musculature exercise. It was great. And the reverse scapular musculature from the one that's involved in the overhead press will be involved in the pull down that we'll talk about later. But there's an awful lot of folks, especially if you work in rehab or if you're a trainer who has clients that have various deficits, maybe because they've been in poor posture for years and they've never done anything active. You may have to work specific scapular muscles in order to get them, well, to improve their integrity, to get them up to normal before they can even attempt to have these muscles working well with the shoulder muscles. Now, the first one I would typically think of is scapular retraction. So once you're sure that this person who's been sitting around in protraction the whole time as part of their normal posture, once you're sure they can achieve proper spinal alignment, once you're sure that they can actively perform retraction, then you may see fit to apply resistance against retraction. And we can do that just in a rowing type position. I'm leaning forward a little bit, as you notice. Why? So that I am perpendicular to the resistance, and then I can retract. And you need to watch, because a lot of people will retract and elevate. That's really not so much what we're looking for, but just a pure retraction. And you may want to watch the amount of retraction, because a lot of people have a tendency to really pinch very, very hard. And that may be useful for some goals such as hypertrophy, but I want you to watch it, because any chiropractor will tell you that a common problem in the thoracic spine is what some people refer to as an anterior vertebral syndrome. But what it boils down to is that part of the kyphosis, the natural curve in the thoracic area, has been reduced, and it's more towards an extended position. It's flat, and that can occur within one to two segments, maybe even 4 segments of this thoracic curve. And the problem is that if they have that going into extreme retraction can irritate it. So for many, many people, you may just want to have them retract to what we would consider neutral, this position of retraction, so they can go from protracted position, not flexed in the spine, but protracted in the shoulder blades, to a neutral retraction. Think twice before you have them go to extreme retraction. Now I'm lying down so that I have a direction of resistance pulling upward, and with my arm by my side, I'm going to perform scapular depression. So I don't want to be protracted like this. I want my shoulder blades basically touching the bench. They don't have to be retracted excessively. In fact, I want them more near neutral. And starting up by my ears and then sliding down into depression. Now, why would I do this specific isolated scapular motion, depression? Well, there's a couple good reasons. Number one, so many people in their daily posture, with the stress and the tension, the upper neck, they're actually not only protracted, but they're in a slightly elevated position. Now, if they stay that way for very long, there's going to be adaptive shortening of the upper muscles and weakness in the depressors. So by performing resisted depression, even if it's light, of course they need to be able to do it actively first to show that they have the neurological ability. But then after that, applying a light resistance or an appropriate resistance, it can be heavier. But the point is that they are doing several things for themselves. They're strengthening those very important scapular aligners they're strengthening the scapular movers and stabilizers, and they're getting hopefully a little bit of reciprocal inhibition in the upper muscles. What I mean by that is, as you work hard to depress, the muscles that elevate should be saying internally, hey guys, let's relax a little bit. And there's an awful lot of your clients and your patients that need some relaxation in these upper cervical and upper trapezius muscles. This depressive motion for the scapula may help with that quite a bit. Now, sometimes people ask me, what's the best way to train protraction? And I don't typically see someone that needs to just do isolative protraction. Typically, they protract at the end of a pressing movement or a punching movement, so that they have this combined motor sequence. But if you did want to train for protraction, you'd simply need a posterior directions of resistance relative to your shoulder and scapular motion. So another thing you might have people ask you is, gosh, how do I train my anterior serratus? Well, the serratus anterior is one of the major protractors. Now, it's going to be involved big time when you do your overhead press, because it's really working hard to get that shoulder blade into upward rotation, along with a bunch of the trapezius musculature as well. But if you wanted to isolate it, you see a lot of people in the bodybuilding world used to say, work the serratus, you a dumbbell pullover. Well, that's the exact opposite motion and won't work the serratus at all. But isolated protraction such as this is almost entirely serratus anterior with some help from the pec minor. Not a bad exercise if that non-functional goal of hypertrophy is what you're looking for, or if you just want to isolate this part of a pressing motion. Now you'll notice that I took the bench off, so I can stand on the foot plate right here. And now I'm going to have resistance pulling a little more downward on me, and I'm going to perform an elevation. Now this is really the most common trapezius exercise, but you'll notice I talked about 3 other isolated scapular motions before I got to this, because I felt like that, well, when people talk shrugs, that's the only scapular thing they think of. And really the only reason I can see right off the bat for most people to shrug is if they have the goal of upper trapezius hypertrophy. Of course, it's going to involve the levator and a lot of other muscles as well. But really, for the average person walking down the street, shrugs may not be very, very useful. But they're still a great exercise when you need them. It can be done well in the Bowflex. Well, I want you to notice something. The way I'm standing right here, I'm actually pulling at an angle slightly backwards, which is not bad for involving even more of the trapezius than just a pure upward motion. One of the things we want to watch is that we don't move towards the ears, as many people describe it, is if you want a more vertical motion, move more towards the back of the head. If I want a slightly more posterior motion, I can angle like this, as I was talking about before. The other person that might want a little light, resisted scapular elevation is that person we were talking about in rehab who has a lot of tension up here. Because as they maintain a muscle spasm all day long, one of the best ways of getting rid of that, besides passive things such as massage, is to actively get in there and tell those muscles to go through an eccentric contraction against resistance and let go of some of that muscle spasm. Now, as we go back to looking at the shoulder complex, and we progress from the posterior deltoid on through to different planes of motion from horizontal to sagittal, we start to, of course, bring in more of the latissimus, which, of course, is a posterior shoulder muscle. But when we think more of sagittal plane, the motion would look more like this. We use the narrow position on the pulleys. We could use the wide position of the pulleys for a variation. I really suggest most of the time for this sagittal plane lat type rowing movement to use the narrow position. Now, there's a couple of things to be concerned about in the performance of this rowing exercise. Number one, I would really encourage you to work on the postural alignment first so that you don't have to worry about whether the person's bending forward like this or not. They should have good control before they start. Secondly, they shouldn't have the desire or the tendency to reach forward as part of their row. The range of motion required is of the shoulder complex. Adding it in the spinal musculature and in the spine itself really doesn't add to the exercise. In fact, it could be adding risk to the exercise. So we're going to maintain better alignment through the whole thing. We definitely want shoulder blade motion. So the shoulder blades or the scapula protract eccentrically as we go forward, and then they retract concentrically as we come back. The amount of retraction probably don't need much more than neutral, but some people may want to go really squeeze their shoulder blades together. Just remember they can do that for some certain goals, but don't forget about the upper thoracic curvature and how that may reduce the curvature if we're not careful. We talked about that in the shoulder blade portion. So there's the motion for you. One other thing that you can do, we mentioned independent movement on this machine. And this is a great opportunity to add in the rotation. Again, spinal rotation It's best if performed in proper spinal alignment, erect posture, but now you can incorporate the shoulder, scapular, and trunk rotation. These are muscle groups that work together all the time anyway. When you do things in real life, when you reach, you pull, you push, you're using shoulder complex muscles with spinal rotating muscles. The key, proper spinal alignment. Now another great feature is the option of bypassing the grip, which again, for many people with tendonitis in the forearm, lateral epicondylitis, this may be a great option. Just spread the handle like we've done before, put your whole entire arm through it, so you're just above the elbow with the strap. And you might grab a hold of the cable up here and take a little stress off, and then you can move the handle back to create a little closure and a little security around there. And then just lightly grab the cable itself. And right there you can go through this shoulder extension, sagittal plane rowing type exercise without having to grip. Who is this good for? Not just the people with the tendonitis, but do you ever have those people you work with? Every single rowing or pulling motion, they say, I feel all these muscles. I feel my biceps. I feel my forearm right here, brachioradialis. We can bypass that by having the load applied directly to the humerus. They're going to be able to concentrate more on the posterior shoulder group, posterior deltoids, lats, all those things, without worrying about this. Now, of course, if part of the goal is I want to work those elbow flexors at the same time because they're part of a normal neurological movement, you can go back to your normal grip. But you have options, and that's the key. Now, keep in mind, everything is a spectrum or a continuum of planes of motion. And with this posterior deltoid type thing we looked at, now keep in mind, it's not just posterior deltoid, it's posterior rotator cuff, it's scapular muscles working, and it's even a lot of latissimus working depending upon the plane of motion. As I move from this horizontal or transverse plane and start to move downward a little bit like this, there was more lat involved, still a lot of rear delt, and I had every little possible plane or angle in between clear up to the sagittal. And everything in here has a slightly different muscular contribution around the shoulder, but all of it involves those muscles I named, latissimus, rear deltoid, those things. And remember, this is mostly latissimus, rear deltoid's helping some, but as you go further back, it's going to be more and more rear deltoid as the lat loses its mechanical ability to create extension behind the body. Now, another continuum or spectrum is changing the angle of resistance so it's more from above. Now, typically we call that a pull down, and we think we have to be seated somewhere and we have to pull something down to us. But don't think of it in terms of relationship to the world, because that's what pull down means. Think of it in terms of the resistance relationship to the body and the specific motions performed. And if you do that, it's really easy to see that even with a pulley down here, you can pull down. All we have to do is change the body position relative to the resistance. Now notice I'm going to scoot way down here, so really my rear is almost off the bench, but, oops, grab the cable. But the point is now I have plenty of room and freedom of cable movement in order to do my pull down. And notice I can do it from the frontal plane right here, and I can create every angle in between the continuum between the frontal plane and the sagittal plane. So right there is my wide grip pull down, as you may refer to it in the gym, a narrow grip pull down, and everything in between, depending upon what's comfortable for the individual shoulder or simply for creating variation for individual muscle groups or for neurological motor patterns. Now take a look, because I want to show you these pull down type motions from this view, but with a narrow pulley and a wide pulley. I want you to see the difference. Obviously, I'm not going to use them this way at the same time, but I want you to compare the difference in the angle of application of the force. Now, if I was to do the frontal plane or wide motion, take a look. Take a look at when I get to the end here, how the pulley is right above my hand, the cable is right above my hand. This one's angled out slightly. I don't know if you can see that very well from your angle, but they're very slightly different. Okay? Now, with this narrow option, I have the ability to move through all these planes, including the sagittal plane. You see how my forearm is still lined up with the cable. With this wide option, although it's a great form of variation or varying resistance application for the frontal plane, as I move more towards the sagittal plane in these different pull-down options, you notice when I get to the full sagittal plane, the resistance is angled outward. Can you see that? I'm trying to look in the monitor there. So you can see that this is not resistance within the plane of motion. So really the wide pulley works best for this frontal plane, maybe a little bit anterior to the frontal plane. But if you want to go pure sagittal plane, you're going to have to move back to the narrow pulley option. Now, another thing for you to take a look at. Look what I can do here. Again, if I want to bypass the elbow flexors, I can just put the pad or the strap right around the elbow. There we go. So there's another great option. Again, with any plane of motion. I could do pull downs here. I could do pull downs halfway in between, 45 degrees between the two planes we just discussed. And of course, I could do a straight arm version. Now I might have to scoot back a little bit. You saw how the cable only allowed a certain amount of motion, but I can still get a great range by scooting back to this point. And then I have a straight arm version, and I can do a similar thing in the frontal plane with the wide pulley. I could do a straight arm version in the sagittal plane, but again, I want to stick with a narrow pulley for that option. And of course, with the narrow pulley, I can do anything in between. So there's many, many options if you think about applications of resistance and planes of motion. Now, continuing to look at the posterior shoulder musculature, let's look at more of the straight arm pull down. You've seen those before. It's the same thing as a sagittal or narrow grip pull down, only we've changed the relationship between the load and the elbow joint, which also moved the load further from the shoulder joint. There will be a situation there not only affecting shear, but affecting the amount of resistance due to the leverage change. So all of those decisions you have to make based upon your client and their needs. Some people with specific shoulder problems, you wouldn't want to do straight arm movements. For a lot of folks, it's going to be fine. Other considerations. You've seen this exercise many times, and there's a lot of ways to vary it in the gym. One of the ways is sometimes people scoot back and do it. Sometimes people scoot up and do it. What difference does it make? Well, there is a difference because we're changing the relationship between the resistance and the arm at the varying positions. Obviously, there's a 90-degree relationship between my arm and the resistance here at the close, as I stand closer. And as I move to this position, there's a smaller force angle between the resistance, the cable, and my arm. So in a sense, the application of resistance is decreasing here. The resistance itself is increasing because the Bowflex rods go from about 65–70% of the labeled resistance in the starting curve, and as they bend more and more, you get near the 100% resistance labeled. So that's something to consider along with the force angle. Not one or the other, but both things overlapping at the same time. So if I stand back here and I actually have the resistance force angle near 90, which is optimal, plus the rod is fully bent, this is a maximum resistance, and this is not necessarily my strongest point. For this specific exercise, it would be better to scoot up so that the force angle of resistance is decreasing its application to my arm as I move towards a weaker position in the motion relative to the length tension and the moment arm of my latissimus and other shoulder muscles. So if that doesn't make perfect sense, please review your mechanics. But we have some other options here as well with this bar besides the stiff arm movements. We can do the more traditional pull-down type movement, but you need to look at where you're positioned on the bench. Many people will want to be right under the pulleys, and this will require many people to have to lean back a little bit, because as we evaluate active range of motion of the shoulder and find that most people do not have 180 degrees of total shoulder complex flexion, we realize that we don't want a resistance pulling them into a plane that they could not achieve actively. So if someone can only flex to about 160 or 150, then I would have to lean my body back to line that plane of motion up with the pulley. On this device, however, because we have a long bench, there's no reason to scoot up that far under the pulley where you might have to in the gym with a narrow seat or a small seat on a pull down. I can scoot back. And now I can sit up perfectly erect and vertical, but my application of resistance is a little bit anterior. Now that is really perfect. Now you'll notice also as I go through the plane of motion, my forearm is staying in line with the cable so that I'm not adding rotative forces to the shoulder while I'm attempting to perform this exercise. Very important. You'll also notice something we couldn't see, so I didn't discuss it, when I was showing you the lying pull down, the scapular motion involved. It's very important that as my arm goes up, the scapulohumeral rhythm allows upward rotation of the shoulder blade to achieve the proper congruency of the joint as well as length tension relationships. And as I bring my arms down, I have an associated scapular downward rotation. Many people you see doing this pull down motion will leave their shoulders up as they do it, and that's why we'll typically want to instruct them in the neurological pattern of having the arm and shoulder move more near unison. And many times if people don't know what's going on in their shoulder blades at all, they may have to start by learning, hey, look, Mrs. Jones, you have shoulder blade motion available. Now let's put that together with your arm. So if you have to teach it in 2 steps, do so, but make sure you work towards or progress towards having them move these joints together, because the idea is to start with the shoulder joints, shoulder joint muscles, which includes the scapular muscles in this case, and not necessarily by starting with the elbow muscles, which is what you see here, okay? Now, of course, I can move even further back and create a variation that you typically can't do on other pull-down machines unless you lean way back, which is sometimes not comfortable for people. But these other variations in angle of resistance is what helps to create overall variation for any exercise and for any person. So this is a great, great idea. Secondly, I can change my grip. Now for the wide grip version, of course, we want to be not any wider than what your elbows would be when you're abducted at about 90. There are mechanical reasons for that you can review. How narrow do we want to be in this position? You can come in a little bit inside the elbow in this position, but again, no wider than elbow width. A little bit narrower is fine, not a lot narrower though. You go a lot narrower, you start to change the plane, which is what we're going to do now. If I go quite a bit narrower, like shoulder width, I can change the plane near sagittal, or I can even go a grip that's somewhere in between the wide and the sagittal narrow grip into here, altering my plane of motion. Some people like to perform a reverse grip. I'm not a huge fan of this exercise because when they do that, there's kind of a fight going on in your body between what the wrist would like to do, which is typically a very narrow grip, and what the elbow would like to do as it extends in a supinated position, which is a carrying angle, which is much wider than the shoulders. You're always compromising one joint or the other when you attempt to do supinated sagittal plane pull down. Now a narrow grip to a lot of people is very narrow into here. And that, of course, will start to put, as you pull down, rotating forces back into the movement. So really the narrowest you should go would probably be shoulder width for your sagittal plane. Now the great thing about this activity on this Bowflex is I don't have to use a straight bar at all. You're perfectly welcome to. Great variation. But I can use my individual handles and have total freedom of movement. And this is actually one of the disadvantages of a pull-down machine in the gym. Is you've got the single cable, and you're pretty much stuck with tying the hands together on some type of bar. Whereas here, I can do my wide version, frontal plane, somewhere in between, 45 degrees in between or something like that. Or I can go sagittal plane, and what else can I do? Of course, I can alternate. I can scoot way back to get these different angles. If you have really long arms and you can't sit underneath it to do the motion, I can scoot back and just lean forward a little bit. There's my motion with no obstruction from the pulley and the cable. No problem. And I'm telling you, these simultaneously alternating motions, so many times in the gym when we learn alternating motions, we hold one still while we perform this one, and then we hold this one still while we perform the other one. Simultaneously alternating motions are more consistent with the body. When you're walking or something, there's not anything holding still while the other one's moving, so you have a simultaneous alternation. What a great option here on the Bowflex. And of course, anytime I use these handles, I can bypass the elbow flexors if that helps you with your goal or your client's individual needs. This is such a great option. And I could use these handles also, even in this straight arm movement I discussed earlier. I can also change my body position like this. So many options. So you can see just with these, with the lat tower here, we've created maybe 20 or 30 exercises and talked about the potential for 20 or 30 others if you alter the plane. So using these options to your advantage and to your clients' or patients' advantage, you really should have unlimited potential. All right, take a look from this position. Hopefully you can see my shoulder blades moving a little bit. I just wanted you to see the direction of resistance from this angle or from this plane. And you can see with my sagittal plane motion that my arm, my forearm and the resistance maintain alignment. And I also want you to notice, start to look at mechanics a little bit, look at the forearm alignment with the resistance here. Because a lot of people look at this and they say, well, isn't this pulley width too narrow for a wide grip pull down? It's not. We can still, if my forearm and the pulley and cable are in alignment here, virtually the resistance is balanced at my elbow. Only if I start to bring it in this direction, if you can see that, does it start to bring in more elbow flexors. Conversely, if I push it out a little bit, now you can see the resistance actually goes out beyond my elbow. If you were to draw a straight line through the cable, it would go beyond my elbow, which is actually encouraging tricep effort at the elbow. Even though the elbow may be moving and the elbow joint is flexing, if the resistance is beyond the elbow, it's definitely not elbow flexors that's doing it. So right there you can create variation based upon what you'd like to have occur in the elbow muscles. And also from this position you can see not only scapular motion, upward rotation and downward rotation, but you can also see the simultaneously alternating movement a lot easier. Doing all these seated pulling exercises is great for a lot of different things. Not only the posterior shoulder musculature, but you're practicing proper alignment if you're doing them right, which is great for everyday life. All these people that have seated jobs, they need to have someone teaching them exercises that also includes, hey, upright posture in the seated position. But everybody also in real life has to do pulling activities at home, at work, whatever, from a standing position. And this is something that there's a lot of pieces of equipment, big expensive pieces out there that allow people to do that. The Bowflex can do it too, just as well as everything else. Now typically in a standing position, such as the curls we're going to look at or the lateral raises we looked at before, we need to stand on the platform to help stabilize the piece of equipment as we're tugging on it. Well, in this case we want to step back a little bit from the platform, so we're going to lock the seat in the mid position. You can see it's about midway along the frame here. And I'm going to stand behind it because that way I can keep the machine from wanting to scoot towards me as I perform pulling exercises in a standing position. So now I'm having to use all of my stabilizers, clear from my hands to my toes, which is great practice neurologically. And I'm not so much worried about whether I'm working lats or rear delts or something right here. I mean, I can do it, but the big concentrated effort is on what's happening here and all the rest of the muscles. And I can split it up if I want to. I can do the simultaneously alternating, which includes, of course, if I choose to, the rotation of the spine, but only in proper alignment, never in the flexed position like this. Again, if you look at coupled movements of the spine and type 3 mechanics in your Biomechanics books that you can get from resistance training specialists, you'll understand better and better why you don't want to do a couple motions at one time in the spine. But this is such a great alternative, regardless of the plane that you choose to pull through. Now another option with the squat attachment is the bent over row. Now you need to evaluate this and see if your client's ready for it, because moving the trunk to a horizontal position in space requires a great deal of stabilization effort. They must be able to deal with that before they can apply extra resistance against the posterior shoulder muscles. But here's what the exercise would look like. I'm going to scoot up where my feet are just about centered near the front of the pulley where the cable's coming from, where my resistance is coming from. And of course, with the barbell bent over row, you can't bend your knees very much because the bar has to get past them. So the tough part, the most challenging part, is keeping the knees straighter while being bent over. It's very, very challenging for the spine. But there's what it looks like. Now, one thing you'll notice, I'm actually in a weaker position at the top, mechanically stronger at the bottom, but the resistance profile is a little bit opposite of that. It's giving me more resistance as I come to the top, and that's why I said you may need to evaluate whether it's going to be appropriate for the individuals you work with. But it's definitely a smooth, inertia-free exercise. Now, one of the most popular exercises has been around forever. You see it in the gym every day. It's on a lot of exercise tapes you'll get from other people, the upright row. Now, a lot of people ask, is that a good exercise or a bad exercise? I hear you say bad things about it. If you hear us talking objectively about an exercise and we bring up potential risks, that's not talking about an exercise. That's not defamatory or anything else. It's objective risk, and that has to be weighed against the benefit. We cannot look at exercises as good or bad. It's really almost malpractice to oversimplify and classify like that. We need to look objectively at what's going on in the joint, and from there we make decisions as professionals whether we use these exercises or don't use them. Now here's what it boils down to. There's many, many ways I've seen people do upright rows. I'm going to try to talk through a couple of them. If I don't talk about the ways that you've seen it performed, you don't need to ask me, you need to ask the shoulder joint. You need to understand enough about the joint that you can make these decisions by looking at, hey, here's what this person seems to be doing. What does that appear to be doing to the joint itself? Now, one of the ways I was originally taught was to come in with a narrow grip. I'm on a straight bar, And I'm trying to lead with the elbows, get the elbows as high as possible and pull to the chin. And later on one time I was actually taught by a professional bodybuilder that if I really want to get everything out of this I need to pull to my forehead. Either way, let's start to look at what happens through the motion. As I lift my elbows and my hand stays down lower, the resistance is pulling me into internal rotation. So it's being passively pulled there by the resistance. And the heavier the resistance, the more it's going to pull it there as I try to lift those elbows. You don't have to read a very in-depth biomechanics book to find that there's a range of motion limitation there due to impingement. You're internally rotated maximally and you try to abduct, which is what I'm trying to do here at my shoulder joint. There's an abduction limitation near 60 degrees. Any attempt to go further than that will create impingement. Now, some people it may be 55 degrees, other people it may be 65 degrees. It's a range. Everybody's a little different. Now, of course, you may appear to be able to get your arm up higher because your scapula starts moving as well. So you cannot just look, is my arm moving? You have to look, is the shoulder joint moving? Is the scapula moving? The things that get impinged, supraspinatus tendon, up against the coracoacromial ligament. You also have the option of hitting that up against the acromion itself. So there's a lot of potential options for impingement based upon whether you're internally rotated, externally rotated, all those kinds of things. There's a lot to study there, folks. You can't just go exercise, look at the skin, and say, hey, I know what's going on. So let's continue to analyze this exercise. You'll say I survived this impingement, and you will. You'll be able to do it for years. But 5 years down the road, 10 years down the road, when people are wondering why they're having shoulder trouble from all this stuff that was supposed to make them bigger and stronger and healthier, then someone's going to have to pay. As I come to this position and people try to go higher, typically you see them performing active external rotation to come out of the internally rotated position. Now, of course, external rotation of the shoulder is an incredibly weak motion, especially if you're trying to do it with a weight that you initiated with a closed chain movement, such as down here at the bottom. This is a strong position of movement. If I select my weight based on what I can move here, I'll have trouble moving it up here. It's going to add to the strain and stress on the shoulder. So basically what this boils down to, objectively speaking, that is not the way to perform it. If someone did try to modify this exercise to eliminate the passive internal rotation, so now they're just abducting without the pulling this way, so not only does it not look like a row, it starts to look more like a lateral raise. Why are we even calling it an upright row? You completely changed the mechanics of the exercise, and you're right, the upright row mechanics are something we really need to stay away from. And if you can find a way to modify it, you can call it an upright row. It's the mechanics we're worried about. Now, of course, a Bowflex might change some of that, just like you could change it with dumbbells instead of using a straight bar. If we put the individual handles on here, a couple of the other problems can be alleviated. You noticed that my wrist position in the narrow grip was compromising as it pulled me towards ulnar deviation at the wrist. By having the handles like this, my hands can float as my elbows move wide and narrow. You'll also notice that I'm not allowing it to internally rotate me. I'm keeping the rotation near neutral as I come up. So again, you can call it a modified upright row. I call it a lateral raise. The name's not important. What's happening in the shoulder is. So really look at this exercise before you go out and prescribe it and impose these forces upon someone. Let's take a look now at the elbow flexors. In standing position, we need to put some weight, force on this foot plate down here. You can't really see it right now, but I'm standing with my toes on the foot plate. And obviously you can just do like a typical standing curl. Keep in mind that your resistance is a little bit anterior, unlike a dumbbell or a barbell where the resistance would be straight down. So I can, in order to achieve the same relationship between the resistance and my arm, bring my arm in line with the resistance. Now you can see this is just the same as the standing curl with a free weight. Just a very slight 10-degree change in shoulder position is all. And if we really want to be strict about this, if you have a non-functional goal, and I say that because hypertrophy, extreme hypertrophy in selected groups is really non-functional, but there's nothing wrong with it. What we might do for this goal of hypertrophy is just keep this upper arm in the same place in which it started. I am not, I repeat, I am not smashing this arm against my side. A lot of people attempt to smash it thinking that it's going to help hold it from the typical mistakes we see where people do this kind of stuff. You just need to use your brain neurologically affecting the stabilizers, be aware proprioceptively of this position, keep it there. It doesn't require squishing it to create frictions against your trunk or anything else. Now, I can scoot back just a little bit and create a little more shoulder flexion, varying the length of the two-joint biceps muscles, not necessarily directly affecting the brachialis and the brachioradialis, but as you can see, it's an immediate variation neurologically and in terms of length tension. But I'm working real hard to keep this stabilized. Another factor you can keep in mind is, as these rods are flexing, they are again going from 70% to roughly 100% of their labeled weight. You may want to alter the force angle as you fatigue. We fatigue disproportionately. You'll get the shorter position, the shorter end of the concentric contraction will fatigue more rapidly throughout the set than the lengthened state. So, as we're doing this, we may find that we have a considerable force angle here. At the same time, the rod is increasing in the resistance that it's offering. We may want to choose a position more like this for our exercise, because you'll notice now this force angle or moment arm relative to the resistance is decreasing dramatically. So even though this is increasing, and some people say, oh, well, this is not going to work well for this exercise because the resistance is increasing but your strength is not, don't worry about it. If you understand mechanics, you can manipulate the exercise so that it works out perfectly. Looking at only one factor will not solve your problems for you. But you can see right here, in fact, I can make it so there's no resistance at the top if I do this. So no matter how much tension is applied here, it'll be through the shoulder joint, because there's a moment arm of resistance at the shoulder joint, but there isn't at the elbow. It's virtually balanced to the elbow. That is an option too as you continue to fatigue, because now I could finish the motion, whereas down here with fatiguing bicep, I might not be able to finish the range. So I could even progress through the set, starting out here, start to get fatigued, can't finish it, can't get the full range. I intentionally alter the position. Maybe I can get a couple more reps, intentionally alter position to get a couple more reps and finish the range. So there you've made biomechanical changes and length tension changes strategically. That is not the same as just unknowingly being sloppy. Okay? Now, obviously, I can do this on both sides. I can do alternating. I can do one side, finish it, then do the other side. I can do simultaneously alternating where they virtually meet in the middle. All are great options. I can also lay down and do this. It'll create the same application of resistance, as you'll see. Again, my arm is in line with the resistance. We got the same situation going on. Just watch that you don't extend your shoulder back here, because you'll end up decreasing the effort of the elbow flexors a little bit. That's how people typically, quote unquote, cheat when they're not strategically doing that. Now, don't forget, functionally, your elbow and your shoulder joint almost always work simultaneously in one direction or another. But if you're going for that hypertrophy of the elbow flexors, you want to hold it still, something like this, something like this. Choose your position carefully. Another bicep exercise, if you want more dramatic shoulder flexion, I'm going to just kind of do this with one arm and kind of face you. But I could use this as a kind of a supportive device, somewhat like a preacher bench or Scott curl bench. And some people don't like those, some people do. I'm just trying to show you the options available on this unit. The thing you want to watch on any preacher curl, which is what we're simulating here, or a concentration curl, is that we don't let the shoulder come up and start doing stuff like this, which really just wastes your time involving all this scapular and shoulder muscle activity. Try to stabilize here statically so that you get all the motion you want just from the elbow joint. So take a look at those options. You could even increase the shoulder flexion even more dramatically if you wanted to, clear to this position, which would be a very extreme shortening of the bicep in the starting position. So again, if you understand all the variation, you can do them all on this thing. Take a look at this. From this angle, you're going to be able to see a little different view of these curls. For one thing, if I start in full supination, I've got this carrying angle to deal with. Now, it's not too bad, of course, unless I'm on a straight bar. Then I have to choose my grip width, which is never shoulder width, by the way, even though every magazine tells us it is. This is kind of nice because these free-floating handles, I could even move across my body like this if I wanted to. So worrying about the carrying angle is not that big a deal. In fact, it occurs naturally right here. The fact that my hands are not tied together on a bar, it occurs naturally. Now, of course, I can do a couple other things that are kind of neat. I can take this handle and have all of the webbing, instead of the webbing split on either side of my hand, I could take it and have all the webbing come off one side of my hand. What does that do? Well, obviously that puts a rotational load. it's trying to pull me into pronation. I'm having to use my supinators harder. Even if I don't actively supinate and I maintain the position, given that my bicep is a supinator, it's going to have a little more stress against it. So that's kind of neat. And of course, I can choose to do a hammer curl, which is a little bit more brachioradialis, and I can supinate as I go up if I want to have that resistance actively involved. So there's some neat options for you as far as the curls. Of course, you can do reverse grips if you'd like to also. But something I want to show you has to do with the pulley width. Especially if someone is relatively wide or has a pretty extreme carrying angle, even if they don't, this is an option. Now, with this wide pulley width, I can allow for a wide carrying angle, or I could use it to even externally rotate slightly at each side for a little variation, a little change in shoulder position. And of course, I could do this in the seated position as well with the wide pulleys. Now, with the individual handles and about half of the lengths of the chain utilized, my squat attachment works well for arm curls. And of course, I can change my grip position if I want to be more near neutral, reverse, even slightly externally rotated, or if I want to supinate on the way up, or just maintain supination with some load against supination. Many nice options with the individual handles. Now, using the straight bar and the squat attachment for elbow flexion, arm curls, I really need to consider the carrying angle again. You remember the carrying angle. It's not here when you're in neutral or when you're pronated, but when you supinate, you can see the lateral bend that occurs at the elbow. We need to allow for that. So what I'm trying to say is the shoulder width grip that we've always been prescribed is not appropriate for virtually anyone in the fully supinated position. There's allowing for the carrying angle, and now we can perform an ideal curl. Taking a look at the forearm musculature and really wrist activity. Of course, obviously the forearm musculature is working statically as we did those elbow flexor exercises. But to work these muscles more actively, which is great for rehab, it actually benefits everybody to prevent tendonitis and those kinds of things. We can bend the leg, use the leg for kind of a platform. Obviously, if I try to put this down on the bench, I don't have any resistance because it's in line with the wrist and the forearm. But putting it up here creates an appropriate application of resistance, and I can even modify it a little bit. Like right here, you'll notice that the resistance is increasing relative to achieving a near 90-degree force angle at the end of the flexion of the wrist. And of course, the broad's flexing also, which further increases the resistance. I could change that some by coming up a little farther like this, so that I'm starting near a 90-degree force angle of resistance, and it actually decreases in terms of its resistance application as I move through there. Now, as I'm doing the flexion, from your point of view, I'm positioned like this with my arm near my body. Reason being is, again, you've got this carrying angle to deal with, which is not quite so evident when your elbow is flexed, but it's still there. It's still there. So I want to be in this position so my wrist can be perpendicular to the resistance. I don't want to be in this position with the resistance pulling straight down. Okay, so I've got to be in here kind of like this. But now, when I perform the extensors of the wrist, it's really hard to keep your arm in here and fully pronate. You'll probably notice from there, my axis of my wrist is not all the way over. All right. Now, the nice thing about this is I don't have to be fully pronated. Because of the direction of resistance, I can keep my arm here by my body. I could do it like this for my wrist extensors. Or, if you thought that was a little too strange and felt funny, you could go back to this position. It's just abduct the arm from the body, abduct the shoulder joint, and then provide that stable platform so that you're basically in neutral as far as the radial ulnar joint is concerned. In looking at the elbow extensors, one of the most popular exercises in an aerobics class, and seen fairly often in a gym, is the kickback. Now, used with a free weight, this is not necessarily an optimal application of resistance. And the reason I say that, again, is not bias against a kickback. It's looking objectively at the fact that when you see in an aerobics class, half the time people are standing up almost straight, therefore they have very little opportunity for resistance against extension. They actually think they're starting here to get their full range. They're using more elbow flexors than they ever will extensors. People doing it correctly end up in this position with a dumbbell, but the resistance is zero right here, balanced below the elbow. The resistance is ever increasing out to this point where it's maximal. But your strength in this single joint movement, you're actually a little stronger in this position where your olecranon acts like an anatomical pulley, as you get all the way out to full extension, in this application of resistance, you lose a little bit of strength. So that's not an optimal application with a dumbbell or a free weight. But with tubing coming from the front, a cable machine, or of course this cable in the Bowflex, and altering the direction of resistance, a kickback becomes a little more viable. And you can see right here, I have about an optimum force angle for the resistance. You can see it 90 degrees to my arm at this position, a little less here, and a little less out here in terms of the force angle. Now, of course, the power rods are bending, so that increases the resistance out here as its application angle is decreasing. So it almost feels constant. It's less here, more, and then fairly constant through the end. This is a pretty good exercise. One of the areas of the body where tendinitis is most common, not only here at the quadriceps tendon, but at the triceps tendon. And very many times when we're using a free weight for these exercises, people don't decelerate fast enough, and as they're coming into the eccentric flexion on the tricep exercise, that's where they get a lot of stress on the joint. The nice thing here is that as I'm coming into this position, I can go to extreme range of motion eccentrically, and I'm losing the resistance here. So I don't have the inertia or the application of resistance that's going to add to that tendinitis. Let's look at a push-down type motion that, again, we can do lying down on the Bowflex because of the directional resistance. Typically, a push-down is performed with the arm stabilized by the side, not smashed against the side, right? We don't have to go to all the adductor effort in order to smash it. Just hold it here so it doesn't move in the sagittal plane. I'm holding my hand in a pronated position as I go through the motion, trying to stabilize here, going to full elbow extension. Look at the application of resistance. You can see how I lose my force angle here, which actually works out pretty well in terms of the strength change within the arm. As I come here, if I go way into the eccentric motion of elbow flexion, I also lose resistance again, which works out well for the tendon. Now, if I alter the position of the shoulder joint within the sagittal plane, I get some nice variation, but I start to change my resistance application a little bit. And it becomes most extreme if I go up here into about 90 degrees of flexion. This really gets tough at the fully extended position, and it's really virtually nothing in this position. So this is not optimal. So in this application of resistance from the direction of your head, a very slight change in flexion and holding it is all that you have available. One other alteration that you can make or variation is in the grip. In a fully pronated position, very few people can straighten their arm out all the way in a fully pronated position because of the crossing over of the radius and the ulna. And that's why an awful lot of people in the pronated position, as they straighten out, will actually internally rotate the shoulder to try to seek neutral in the radial ulnar joint. If we change the grip plane, then we can maintain a neutral grip the whole way through. This works out better for almost everybody. This is a great option. It allows you to keep the axis of your elbow where you want it. You, of course, can do a reverse grip, which is in a supinated position. Realize, though, that there is no muscular alteration. In other words, the tricep doesn't work any different between all these different grips like a lot of people think it does. Some people think one head works more than the other. That's not necessarily true. The big thing that changed was in terms of the radius and the ulna, whether or not you get to complete the motion. Now, I can make another change. If I take the bench, angle it to the position we used for chest, now that 90-degree shoulder flexion position, stabilizing it there, I get nearly the same resistance application that I had with my arm by my side in the supine position. I hope you can see that. Rewind if you need to see that I have this nice decrease in resistance right here where my arm is actually weakest in terms of single joint activity. That works out really well. And I can move it upwards a little bit more if I need to go through the more extreme of shoulder flexion. So if you want to add variation of shoulder position within the sagittal plane, changing the angle of the bench and the Bowflex works extremely well. Looking from this view, you can see that I'm in the angled bench position doing the tricep exercise again. But something I wanted you to see was the fact that an awful lot of people have trouble externally rotating far enough. You see when I bring my arm up to here, I've got to externally rotate to keep the resistance within the plane of motion. Because here's the axis and the plane is perpendicular to that. Now a lot of people can't externally rotate that far. So you see them doing things like this, pushing out to the side, which is better to do probably on the Bowflex than with a dumbbell or something like that, but it's still not optimal. It's still not the way it should be. So unless someone can get right in here tight like this and maintain it themselves, do not, as a trainer, push their elbows in, because if they can't do it themselves, there's something indicating they shouldn't be doing it. Something we can do with a wide pulley position, however, is come across the body. So again, this attachment that moves the pulleys in and out can be used, as you've seen, for so many different body parts. But watch this. Now I can come across the body, because as you've seen many times, I'm sure yourself, even if you're going all the way overhead with a dumbbell, trying to keep that elbow in there and that hand out, it's really tough. Going across, it's a lot more congruent with what the shoulder joint wants to do. So there's a great option with the Bowflex when coming across. The narrow pulley can work for some people, but just realize that as that pulley comes in, this cable is going to have a tendency to come against my body. And that may be a little bit tougher for a wider person, or if they don't have the ability to get their arm all the way over. But you can see I can hold this arm even out here to this position, not even straight up, and still perform this exercise with the wide pulley position. Now, a more traditional push down can be performed from standing position if you have a lat tower. And on this, we're using the straight bars I'm showing you right here. I'm going to grab about shoulder width so that I can perform just the elbow motion. You've seen people grab real narrow, and when they grab a bar narrow like this and fix their hands on it, they're going to have a tendency to move their shoulders too, which doesn't hurt anything. It just may not be isolating the joint motion that they want. It's up to them. So I'm going to grab about shoulder width, and you can see it's really easy to stabilize my upper arm by doing that. Now, I have a lot of other options here. Of course, I could do a reverse grip, but as I mentioned, it doesn't change anything in my tricep. But if I use a reverse grip, I also have to allow for that carrying angle that we discussed earlier. Even though it's a tricep exercise, the carrying angle doesn't have anything to do with whether it's biceps or triceps. It has more to do with whether you're supinated or not. Now, if I get rid of the straight bar, I can use the single handles. That gives me some more options. Of course, I could still do it in a pronated position if I wanted to, and I could use the simultaneously alternating if I wanted to. But I could also go to the neutral grip, which, as I mentioned, is ideal for tricep work because it's easier to stabilize. You're not always trying to unwind this elbow by encouraging shoulder motion. I want to bring up one more thing about these push downs. A lot of times when people are using the individual handles from each pulley, they start to think that in some way has to do with the rope handle push downs they've done before. The rope type handle, I've got the two handles on this one cable right here to show you. As I push down like this, there's a fairly consistent resistance, as you would expect. But as I start to use the rope for what it's good for, which is spreading it apart, my resistance changes. Don't be deceived by the fact that there's maybe 30 pounds on here, so I think there's always 30 pounds of resistance pulling against me. Folks, the angle at which the resistance is applied makes all the difference in the world. And if you haven't studied mechanics, you really need to get a grip on that concept, because right here you can see the angle at which each hand is pulling becomes very different, and they're pulling off to the sides here. My effort off to the side, spreading the rope apart, requires a lot more effort than just what it takes to push straight down. So as the further this thing spreads apart, my force requirements goes up a lot. In fact, as it gets almost straight out, it goes up almost exponentially. So that's a huge increase in resistance right here, even though the resistance wasn't increased in the rods or in this cable. It has to do with the angle of application. That makes this a little bit better option. Of course, you could have a longer rope, because a longer rope handle wouldn't spread so far. That would make it more consistent. But this is a great option right here because, sorry, I'm going to go behind these rods, but you can see as I push down, the direction of resistance on each side maintains itself within the plane of each elbow. And what a great option that is. Now you have the resistance changing only based upon its angle of application to the forearm, which is diminished as I straighten out, and the slight change that occurs in the rod itself. Using the squat attachment for triceps, you can basically do a supine tricep press, which is meant to be a single joint movement, elbows moving only, stabilizing the upper arm. Now we can alter the shoulder position and affect the application of resistance. You'll notice right now I have the resistance almost lined up so it balances at the top position. But I could hold my shoulders in a little more flexion and have a very different application. So choose your application of resistance based upon your goal and your individual needs.